if sobrang severe nung ADHD behaviors nila, makaka-affect talaga sa learning. So some of them,
Mhm.
bumabagsak, wala namang learning disability, but through the years, let's say undiagnosed and hindi masyadong napapansin or hindi iniintindi, ganyan, bababa yung grades. And then sometimes, some of them can develop a learning disability. So that's when medication can somehow be helpful kasi kahit anong gawin parang na conservative method yung mga therapy and techniques, hindi talaga kaya or nahihirapan pa rin yung bata and it's still affecting their.
Mom, Dad, are you worried that your child is easily distracted, unable to sit still, not waiting for their turn, or you get concerns from the teacher? In this video, we will talk about ADHD or Attention Deficit Hyperactivity Disorder, which is characterized by being overly active, having trouble paying attention, and having trouble controlling one's impulsive behavior. Mom, Dad, are you concerned that your child is showing some of these signs? Or you get a negative feedback from the teachers? Or your child already has a diagnosis of ADHD and you want to learn more? Well, I'm Dr. Kristine Alba Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. Join me as I welcome my guest, Dr. Sheryl Kho. My guest is a friend and colleague, Dr. Sheryl Kho. I've known her for 5 years now. She is a developmental pediatrician and she's a wonderful resource. I ask her a lot of questions about child's development, language, and behavioral problems. And she has helped a lot of kids and families. Help me by welcoming Dr. Sheryl Kho to the show. Hi, She. Welcome back.
Hi, Tin. Hello, good day sa lahat. Thanks for inviting me again.
Yup. Thank you for coming back. So ADHD, you do get a lot of ADHD patients as well in your clinic.
Yes, of course, that's parang the second
Mm-hmm.
concern. And sometimes it's actually the presenting symptom. So yes, I often do get it.
Mm-hmm. So let's dive in. How about ADHD meds? Um, what do you say to parents who are hesitant to start their kids on ADHD medications? What do you think about that?
That's a good question kasi if you think about ADHD, meron talaga tayong mga stimulant medications available, no? Unlike other conditions in development like autism, there's really no medication for them to take.
Yes.
But there are age recommendations din. Hindi porke na-diagnose yung 4 years old ng may gamot, immediately we want to treat right away with stimulant medication. So usually, the medicine is recommended for kids who are a little bit more older, yung mga school age like 7 pataas.
Okay.
Number 1. Number 2, there has to be na-try na nung bata na mag-therapy, na-try na ng parents na mag-enforce ng routine, ng positive parenting, ng
Mm-hmm.
structure, but the child still has trouble following what is expected or following rules, di ba? So then that is the time that medication may be recommended because habang maliit nga yung bata, they're developing their their skills, they're developing their knowledge, and if sobrang severe nung ADHD behaviors nila, makaka-affect talaga sa learning. So some of them,
Mm-hmm.
bumabagsak, wala namang learning disability, but through the years, let's say undiagnosed and hindi masyadong napapansin or hindi iniintindi, ganyan, bababa yung grades. And then sometimes, some of them can develop a learning disability. So that's when medication can somehow be helpful. Kasi kahit anong gawin, parang na conservative method, yung mga therapy and techniques, hindi talaga kaya or nahihirapan pa rin yung bata. And it's still affecting their education or their functioning every day. Then medication is really recommended. But recommended, no? It's always still a joint decision between the doctor and the parent to start medication.
Is it also a cultural thing, She? Kasi sa training sa US na I remember usually first line yung ADHD meds, then is it because different settings sa atin dito sa Philippines, or yeah, is it a cultural thing as well? Or
Actually, may fear. Even in the US, no, I've encountered parents there who are hesitant to
Mhm.
start medication, 'di ba? Kasi parang ang feeling parang may sira ba yung anak ko? Parang ganon. Kasi ADHD is it's a neurobehavioral disorder, right? It comes from the brain. So there's a lot of hesitation. I think more in the Philippines because less awareness and less knowledge. But I've had experiences where the kid starts the medication and it's like a brand new world
Yeah.
kasi better functioning of the child individually. Second, better functioning of the entire family
Uh-huh.
because the child is no longer super kulit, nasa-stress out lahat ng tao. And then what happens kasi pag nasa-stress out na yung parents or yung mga lahat ng tao sa bahay, negative yung approach dun sa bata. Kasi lahat na lang parang ang kulit. Wala nang ginawang maganda yung bata or
Oh.
lahat ng sinasabi ng parents negative. And of course, these kids who have ADHD, they really they don't sometimes process things. Hindi
Mhm.
nila sinasadya kasi kung
Oo.
kaya naman bakit hindi? They can't help it. And sometimes they can. Sometimes there are kids who nananadya din. But yung in the true sense of ADHD, they have a hard time processing and making decisions, thinking about the consequences of their behaviors. They just they just do things. Kaya nga
Mhm.
hyper sila, hindi nila iniisip, baka masaktan ako or si mommy naiinis na sa akin, titigil na ako. Hindi, kasi para silang may motor eh. Diba?
Oo.
Para energizer, ganun. Hindi na uubos. So sometimes that can affect their their mental health. And they feel bad, 'di ba? Now they might have self-esteem issues. Some of them can also develop depression,
Yeah.
anxiety.
Yeah.
Kasi nga yung external factors plus because it is a brain-based condition, sensitive din talaga sila sa mga ganung tawag dito, ganung parang techniques or ganung negative na approach. So, pag nakikita ko minsan na parang nasistress na si mami, nade-depress, tas yung bata
Mhm.
parang ang sama na ng, alam mo yun, ang sama na ng feeling sa sarili. I
Oo.
really suggest, no, to do a trial with the medication. And
Okay.
yun nga, talagang about 80% of the time, it really helps.
That's good.
It's like a light switch that parang turns the light on in the dark room.
Mhm.
Yung ganon.
Mm.
So, pero you have to weigh the benefits and the risks, of course, kasi nga, hindi naman din lahat bagay na maggamot na lang basta-basta.
Mm. Thank you. I think those are very useful tips, She. Salamat. So, for parents who want to reach you, how can they reach you?
So, I have a Facebook page. They can search Sheryl Kho, .dbp. I'm in St. Luke's, Quezon City. All the other clinics that I go to, yung information nandoon din sa FB page ko. So they can just visit and call the numbers on the page.
Thank you so much for this, She. What a very nice
Welcome.
journey. Thank you for coming back.
I enjoyed talking about ADHD and our past topics. So looking forward to more.
Yeah.
And thank you so much, Tim.
Thanks. Bye.